Okay, thank you, Chair. Thank you, colleagues. I have the pleasure to present on the post-placental insertion of intrauterine device, what we call IUD, and it share a good opportunity to increase contraceptive uptake in African countries. Next, please. Oh, I think I can. Yeah, the rationale of this initiative that, as we know, family planning is a key intervention to improve maternal, newborn, child, and adolescent health. And people think sometimes that family planning is just for maternal health, but we can see that behind maternal, reducing maternal mortality, it has a great impact on newborn health and child health and even adolescent health. And unfortunately, there is a very high unmet need for contraception, reported especially in the immediate postpartum period. And we can see that postpartum period is sometimes a missed opportunity to take advantage of the low-hanging fruit. Because during the postpartum period, we have the woman with us, and we can take this advantage to give counseling and provide the postpartum family planning. And the postpartum post-placental insertion of IUD is an innovative approach to adequately address this missed opportunity. What is the global challenge for family planning? We can see that globally there is more than 200 million women with unmet need who wanted to have a contraception method but cannot have it. And with result of this, 74 million annually have unintended pregnancies, which result in 20 million unsafe abortions. And we can see that unsafe abortion is a leading cause of maternal mortality, up to 30 to 40% of unsafe of maternal mortality globally. We can see also that from various studies, if unmet needs are met in developing countries for modern methods, we can have unintended pregnancy dropped by 70%, maternal death would drop by 67%, and newborn death would drop by 77%. That is very important, and sometimes people don't think about it, but it's very important beyond maternal mortality. And also the burden of disabilities related to pregnancy and delivery experienced by women and newborn would drop by 2/3. Yeah, just to show the importance of postpartum family planning in the world. And we can see through this graph that maternal mortality ratio is really linked to the use of contraception. Each line is representing a specific country, and we can see that when the contraceptive use is increasing, the maternal mortality is decreasing. So just to show the link between the maternal mortality and contraceptive use. The same here is to show that the negative maternal and perinatal outcome linked with the short interpregnancy intervals. So when the pregnancy interval is short, we have a lot of negative maternal and perinatal outcomes such as miscarriage, low birth weight, maternal death, and preterm birth. The same with short interpregnancy interval linked with negative outcome of neonatal and infant health. And we can see that when the interpregnancy interval is short, we have negative outcome on neonatal and infant health, such as early neonatal mortality, infant malnutrition, and low birth growth. Unfortunately, when we take the case of Africa, we can see that there is a huge unmet need for family planning. You know that we can see that the majority of countries are spent with red. That is say that universal access to family planning services are not reached. We have a lot of effort to do. And as a consequence, we can see that adolescent birth rate is really huge in our region, rating from 8 to 210 pregnancies for 1,000 adolescents. This is really a challenge for our region. The challenges in the African region is the low quality of services, of course, the financial and social cultural barriers, and the monitoring and evaluations also. Now, why scale up post-placental insertion of IUD is that first, a good safety. It avoids discomfort related to standard insertion of the IUD, and there are very few contraindications. Of course, we have also a cost effectiveness of the method and the good efficacy because the greater reduced risk of subsequent pregnancy and no increased risk of expulsion. And the women have not to come back to the health facility to receive this contraception method. It's immediately after the delivery and is very safe and effective method. Important effectiveness, how we say, the high woman motivation for contraception, the benefit contraception immediately after the delivery, and the accessibility, no return visit to start the contraception, and acceptability and satisfaction. This have been shown in various studies. And the high impact, of course, it's shown that this increased quickly and significantly contraceptive prevalence rate. If we can ensure that all the women that have delivered can have access to this immediate postpartum family planning contraception, this will really increase quickly and significantly the contraceptive prevalence rate and avoid, of course, missed opportunities. Of course, the implementation of this postpartum insertion of IUD should be implemented with implementation research, with scale up activities by implementation research, better assess the program performance, inform the implementation, facilitate health system strengthening, and also facilitate integration into health systems and ensure sustainability. So all these drugs should be made available in the delivery rooms so that the woman can receive it before going home. Some opportunities exist for scaling up this postpartum insertion of IUD. There are already a good acceptability in pilot studies in many countries. Better awareness on postpartum family planning as a priority interventions now from countries, from partners, and from also individuals and families. And there are also global initiatives for resource mobilization that can support these initiatives, such as the Global Fund, global financing facilities, and others.